Thank you. So today we have 6 new cases, all overseas acquired and in hotel quarantine. That brings us to active cases in Queensland 41. I want to thank all the Queenslanders who have come out and got tested over the last 24 hours. We've had over 10,173 tests, and I'm very pleased that we've had 3,313 vaccinations in the last 24 hours, which means that we are seeing the number of vaccinations per day escalating as we bring more sites online. So that's really great news. Other positive news is that with all of the tests we have done so far in relation to the PA and the Hotel Grand Chancellor, that all of those results have come back negative so far. And of those, so we've had 428 close contacts of the PA doctor. The results we have back so far, 77% of the results all show negative. Of the staff that have been close contacts and have all come back negative at the Hotel Grand Chancellor, and also the other staff, so there's another 98, we already have 96 negative results back, which is fantastic. Of the guests that were on floor 1, so the guests that are there and the guests who have left, we are still getting results for those. I can say the 9 that are still on that floor and have had their time extended, they've all come back with negative results. So that's very reassuring that we have a large number of those close contacts, both from the Hotel Grand Chancellor and from the PA, they've all come back negative, which shows that the quick action of the doctor and also getting these results and taking the measures we have taken means that we are in a very good position going forward over the next couple of days that will hopefully see us be able to lift those restrictions around hospitals and aged care and disability centres, and also youth detention centres and correctional facilities be able to be lifted on Friday. Now, in relation to the hotel quarantine guests in Hotel Grand Chancellor that are not on floor 1, any of them who complete their normal 14 days will be able to be released as long as they get a negative test upon leaving. So that includes those who have had to stay beyond their 14 days, who are on any other floor other than floor 1. They will be able to leave from midday today if they have a negative result. Unfortunately, those on level 1, we are asking them to complete 14 days, irrespective of how many days they've done prior to that, 14 days from the 9th, just to be absolutely sure that there's no transmission. I also want to just say we're aware that with New South Wales cases, I'd ask anyone in Queensland who has travelled to New South Wales in recent days, please check out the New South Wales COVID website, have a look at the sites that they've listed to assess whether you have been there and whether you now need to follow the directions of the New South Wales government. So again, anyone who has recently come to Queensland and been in New South Wales, we please ask you to have a look at that. We are not making any decisions in relation to New South Wales at this stage based on the case they have, other than keeping a watching brief and asking anyone who's travelled to New South Wales to check that website and make sure that they are quarantining and getting tested if they've been to any of those sites, or of course if they're contacted by New South Wales Public Health Unit as contacts. There is another issue that has arisen, and that is that in relation to the AstraZeneca, we are seeing some people who have had severe allergic reactions or anaphylaxis in the past, that they are reacting to the AstraZeneca, and this issue is being raised at a national level. Dr Young and Dr Bennett are actually in Canberra today to talk more generally in relation to COVID and the vaccine, but they are raising this issue with their colleagues. But in the meantime, we are putting in place precautionary measures that anyone who's got a severe allergic reaction in the past to any sort of allergic reaction or anaphylaxis, that they delay getting the vaccine. Alternatively, we will be observing them for longer after their vaccination. In relation to the rest of the people who have not reported ever having a severe allergic reaction in the past. We will be making sure that we monitor them for half an hour now, just to be sure, while these discussions happen at a national level. I want to reassure people that we have absolute confidence in our vaccines in Australia. As the Therapeutic Goods Administration has said all along, that there is a risk category there in relation to people who have allergic reactions. We expected this, we are prepared for this, but we do want to make sure, because we are seeing a number of people react to the AstraZeneca, that we are letting people know about that and monitoring them for a longer period to make sure that everyone is safe. I'll hand over to Dr Wakefield to just comment a little bit more about the allergic reactions and how we're responding to that.
Thanks, Minister. So in the past 48 hours, we've had 4 cases of anaphylaxis. 1 case in Bundaberg, 1 in Toowoomba and 2 in Ipswich. Now, as the Minister said, we expect with a vaccination program to see allergic reactions. What is anaphylaxis? Just so that everybody's clear what it is an emergency, but it's the sort of response that someone has, like when they have a bee sting, or that certain people have when they have a bee sting, or if they're allergic to seafood, or something similar like that. So it's not some unknown, we know about it, and you'll know yourselves that certain people carry around EpiPens to cover for that. So that's the type of reaction we're talking about. So having seen 4 of these in the last 2 days, we have all of those cases. We had treatment immediately. We're trained for that. We're very skilled in providing that. They've all gone home after a period of monitoring, so they're all safe. So what we've put in place, just whilst there is certainly whilst the TGA and nationally they just explore this, is just an extra blanket of safety, which is monitoring people for an extra 15 minutes. And if people do have that strong history of anaphylaxis, that we will talk to them individually and recommend that they perhaps hold off until we get this further information. So is there anything to worry about? Well, we have kept Queenslanders safe for this pandemic. We will keep people safe during the vaccination program. It is essential that people get vaccinated, but that trust that Queenslanders have in us, we want to preserve, and we do that by making sure that we have absolute transparency.
Dr Wakefield, did those 4 cases have a history of severe allergic reactions?
So all those cases had a history of severe allergic reactions to other things. So our current policy and the national and TGA policy on this is that it's fine for people to have the vaccination unless they have a history of anaphylaxis to products that are in the vaccine itself. So some of the components of the vaccine. So now that stands, that is the national guidance, and I would remind everybody that there's been millions of doses of AstraZeneca around the world safely used. I'll be getting my own when it's my turn. So, but what we've done is essentially said, well, look, let's have a look at these cases. Let's see if there is anything anything else that needs to be done. That's a national issue. That's an issue for the TGA and the expert guidance of ATAGI. In the meantime, we'll just act to keep Queenslanders safe, and I think that's the reasonable thing to do.
Those 4 cases in the last 24 hours, have there been any others outside those 24 hour period?
4 cases in the last 48 hours. And so I remind everybody that this is week 4 of our vaccination program, but it's only the 2nd week of our AstraZeneca rollout because those doses came only recently. So these are the first 4 cases we've had out of around 3,000 injections of AstraZeneca. So I don't monitor that from a national perspective. I'm sure that there has been other cases of anaphylaxis, but that's why it's important that every single one of these reactions is reported immediately to the TGA, and that's been done by us. Each one of them, whatever the reaction is, including these, and that's the job. It's when you look over the top of that as the TGA, you can see patterns. And as I said before, in the UK, there's been over 10 million doses of AstraZeneca, and they've been monitoring that. So again, I think that, you know, we can be assured this is not a brand new thing. There's been millions of doses given. Our job is to make sure that the monitoring, you know, that we report these and we make sure that they're considered as part of whatever further action is needed. So we've had 4, I get notified of all the anaphylaxis. We've had 4, they're the only 4 we've had with respect to the vaccine program for AstraZeneca. So that's the issue that I guess national surveillance is going to help answer that question. So that's being followed up, and as the Minister said, unrelated to this, there's a meeting of the Chief Health Officers today, and certainly we've already had conversations with the Commonwealth about that. So that's one potential hypothesis. And again, what's the right thing for us to do in Queensland? The right thing for us to do is to preserve the trust of Queenslanders, and just add that extra blanket of safety whilst this is being worked out. So it's nothing that anybody needs to have serious concerns about. We are just making sure that we are cautious.
You said before in the past 48 hours there have been only cases. What about the nurse from the Gold Coast?
Yeah. So there has been that case with Pfizer. So again, let me step back. We expect with vaccinations that a small number of people, it's fairly rare, but a small number of people will get anaphylaxis. Okay, that's not a surprise. We report them, we treat them, and so on. The thing about this vaccination program is, nationally, if you're having the flu vaccine or any other type of vaccine and you have anaphylaxis, it's treated and you'll never hear about it. Because there's so much focus on this appropriately, on this vaccination, you're hearing about every single case as it arises. So yes, we have had an anaphylaxis with Pfizer, and we expect to get more. The issue with this is, you know, getting 4 within a 48-hour period. We think we probably need to have a closer look at it. One that I'm aware of with Pfizer. So nationally, the guidance has been wait 15 minutes, but if you're in what they might call a high-risk group, so you've had anaphylactic reactions before, we err on the side of caution, and that's extended to 30 minutes. So that's what we're doing here. All we're saying is that if you do have this history of anaphylaxis, if you do have that, we're not talking hay fever here or mild allergies, we're talking if you have a history of significant allergic reactions to food or to bee stings or whatever it is, that when you that's considered and discussed before you have the vaccination. We would advise until we get to the bottom of this that you perhaps we would advise that you perhaps hold off. But that's a choice of a person. I mean, you know, the whole point about vaccination is that we protect against is that the balance of benefit is significant towards protecting the community. So we're going to advise people, but ultimately it's their choice, and we will look after them you know, we will manage that through the extra length of observation, and if they have a problem, we're prepared to deal with it. I think that's a question best asked of the Chief Health Officer, but it is relatively rare. So yes, you know, we would regard this. That's why we are acting now, because we would regard this as perhaps more than we would expect.
Maybe for the Health Minister, but if it did become a really serious concern, would Queensland be prepared to act independently and stop the rollout of vaccination?
No, that should be a decision of the Commonwealth. I just want to reiterate what Dr John Wakefield has said. Any other vaccine in this country, there are reactions to it, they're treated, and we never hear about it. We put out a notice to the vaccination hubs today simply saying you should make people aware. If they've got they've had a severe allergic reaction or an anaphylaxis in the past, that they may choose to delay the vaccination, and that for everyone else will be just extending their observation for a little bit extra time. We put that out this morning, so we're standing up today as a matter of transparency and letting the public know that we've told our vaccination centre staff that that's the conversation they should be having with people when they come in to get their vaccinations today and their booking. This conversation will be had at a national level with the Chief Health Officers, and we'll await their feedback on what else should be done. But it is simply about making the public more aware and giving people choice who are in that situation.
The federal government and also the state opposition yesterday called into question the amount of stockpile of vaccine we have. The numbers recently up to 70,000 doses currently haven't been used. Do you agree with those numbers? If so, why are there so many doses
Look, I am just not interested in playing tit for tat with the Commonwealth about how many's being delivered. What they're not saying is the days they're delivering, how much notice we're getting, when we're being told the next batch is coming. So to simply talk about figures and not put a context around it is just a bit misleading. The issue is not how much has been delivered against how much is being administered. It is, are we delivering our vaccination rollout the way we agreed with the national and every other state and territory? And the answer is yes. And in fact, we are ahead. We were aiming for 6 weeks. It looks like we might be able to do all of 1A for their first vaccinations now in the 5-week period. That's great. We're already being able to extend into the Torres Strait, as we heard yesterday, and the Gold Coast University hospitals already completed their 1A group for all of the health workers at the PA and moving on to the 1B. So I just don't think this adds to the public conversation around the vaccinations to constantly talking about deliveries. We heard from Dr Gerard yesterday that we were told we were getting a delivery, then we were told over the past week we weren't getting that delivery, that the larger delivery we had had the week before will have to sustain us for another 2 or 3 weeks, and then with very short notice we were told actually you're getting a batch tomorrow, but we didn't know whether it was going to arrive or not. And as I stood up with Dr Gerard yesterday, it had arrived just within the last hour. So that's how quickly we are reacting. That's why I keep congratulating our health workers. We get told it's coming, the next day it physically arrives on a flight and gets driven out to a hospital, and we start administering it. So are we administering every single dose that arrives? No, because we have to keep some in supply for our second vaccination group, so everyone coming back for their second vaccination group. And we also need to ensure that we've got supply going forward while we await certainty from the Commonwealth. Now, as I said yesterday, with the Pfizer vaccine, we know that the numbers we've been given for following weeks with Pfizer is less than the total number of vaccines we need to be giving for our second injection for the 1A group. So of course we need some in supply. The Commonwealth are also holding back, and I don't criticise them for it, but what I'm saying is the Commonwealth themselves acknowledge they're holding back on vaccine supplies for the same reason, and so are we, and so is every other state and territory. So we've got to stop talking about how much is being delivered and on what day, and just say, are we meeting the targets that we put to the Australian people, the people of Queensland? Are we moving through the phases at the rate that we said we are, particularly for the first vaccination? And the answer is yes.
Minister, what would be your message to Queenslanders who may be reading about global news around AstraZeneca and now you're out in Australia, who might be a little bit anxious about getting the vaccine? What's your message for them?
My message is simple, that this is a safe, both Pfizer and AstraZeneca is a safe vaccine. There are always exclusions. The TGA said from day one, women who are pregnant, women who are breastfeeding should not get the vaccination at this point until we get more data internationally. And they have already said those who have had reactions in the past to any of the ingredients that form part of this includes Pfizer, including that vaccine, then they should not get this vaccination. So this is not new news in the sense of we are seeing allergic reactions. We are not surprised we're seeing allergic reactions. but we do want to let the public know. That's all what today's announcement is about. But people should not be concerned. And again, anyone out there, and I know there are some out there, politicians, former politicians, out there making comment about the efficacy of these vaccines. Can I say, listen to the clinical experts. That's who I'm listening to. I will take my advice of the Chief Health Officer and of the TGA. I'm not going to take my advice of a politician or a former politician as to whether this is safe. It is extremely risky to be going out there and questioning the efficacy of this vaccine. It's irresponsible. It shouldn't be done. And just as we've done through all of COVID, we listen to the experts and factually report on that, and don't listen to anyone else who's got an opinion of whether it's safe or not, because they don't have the experience, the knowledge and the evidence to back them up.
Of the 6 cases, how many of any of them from PNG, and can you tell what Queensland
I believe it's 2 from PNG.
And what's Queensland's current involvement with assisting PNG? Can you give us
The Premier will be speaking about that today. I don't have the breakdown across the state, but I do know that we're rolling out to a number of the islands in the Torres Strait this week, and we started with Thursday Island last week. What prompted that was going to the march. It was extraordinary. Yeah, in Queensland, I saw reporting around 10,000. What I know is there was a sea of men and women supporting the end to sexual harassment, sexual assault in this state and in this country. I saw so many signs of women holding up saying, you know, I've been sexually assaulted by a work colleague, by a boss, I've been raped, and I just found it so moving. And yesterday I just thought, look, if someone like me cannot stand up as the Health Minister, as the former Attorney-General, and can't speak about my experiences, then what hope is an 18-year-old who's being sexually harassed in the workplace, or anywhere else in sport, in the media, in the arts, in the community? What hope have they got coming forward and having confidence that they'll be believed? We have to tell our story. Yes, mine was many years ago, but it's still very fresh in my mind. I have no doubt the 2, I was going to say gentlemen, but they're not, the 2 grubs, I experienced, probably thought nothing of it, and probably never given it another thought. But it's still on my mind, and after listening to so many women's stories over the last few days and weeks, I realised, we have to share our experiences, and we have to lift the prevalence, lift the awareness of prevalence, because if we don't share our lived experience, we're not going to know how prevalent this is in our community. And when everyone realises how prevalent it is, and when I say prevalent, can I be very clear, the majority of men and women do not behave like this. This is a small part of our population who are disrespectful to other persons. Yes, it happens a lot to women, but it happens to men as well. But particularly, there's men who just think it is their right to use and abuse women at their whim and not be held accountable. And we have to speak up. We have to be believed. And I hope that me speaking up, and I was overwhelmed by my colleagues this morning. I didn't know their stories till I looked at the paper this morning. My immediate response is, I'm not alone. Thank you.